Welcome everyone again to Hearing Health Insights with APPF, where we bring you exclusive interviews with independent audiologists in South Africa and our member database. Our goal is to help the public to understand more about hearing health and the professionals who play a critical and crucial role in ensuring that you, as the patient, get to see the person you want to see and get to receive individual attention. So without further ado, I would like to introduce everyone to Keitu. And I'm so excited to meet you today because firstly, we've never had you on the podcast. And secondly, I haven't worked with you with patients or in a collegial way just yet, on an audiological way. So I would love to just know a little bit more about you and your practice and really what your passions are in independent audiology in South Africa. So welcome and thank you for joining us today.
Thanks, Cara. I'm happy to be here. I'm very excited to be a part of APPF. I think I joined late last year, I believe. And I have to say that I definitely do see the benefits. It's so nice to have a community of audiologists that are, in the same boat as you, doing the same things as you, or, people that you can look up to for future adventures or, trying to grow your business and things like that. So yeah, I'm very happy to be a part of this group. I graduated in, I think, 2015 at WITS. And I did my ComServe in Mpumalanga for a year. Then I came back to Joburg, where then I was a speech therapist and audiologist in a government clinic in Soweto. I did that for about 7 years. So I eventually left and decided that I was going to do my private practice full time. And that was last year, April. I've been doing that since. And because of that background, I mean, in the government setting or clinics rather, we were doing a lot of campaigns, prevention and promotion, health talks and things like that. And that has grown to be my passion. I love doing screenings. I love preventative audiology, basically. If we can get a patient to not have a hearing loss or if a patient has a hearing loss, if we can get it early on and treat it early on, that is my passion.
Keitu, it's so nice that you also joined the Independent Audiology Network. I just want to know from you, you mentioned screening hearing and making sure that you educate people around hearing loss well in advance. What's your passion in audiology? What's the type of person that you would usually see come through your practice door? Is it mostly adults or do you see children as well?
In the clinics, I used to see a lot of adults, and I had grown to enjoy the geriatric population. I think there's just something so special about the elders. They have a lot of wisdom to share, and they always treat a consult like a catch-up session. So because of that, I've grown to love that population, especially. I don't, unfortunately, see them as much in my private practice. I would love to see more, but I actually see your 50-year-olds, 40-year-olds, and quite a lot of peds as well. So middle ear pathologies, quite a bit of those from schools, even things like mumps. We saw a mumps case the other day, and she had a single-sided deafness, basically. So yeah, we see quite a lot of those cases here.
It's amazing that you say you're so interested in preventative audiology, and something that I just chatted to Dr. Darrow about, who's been a mentor and really a pillar of support for independent audiologists in South Africa. And he says repetitively to patients, to physicians, that hearing healthcare is preventative medicine, and it really, really is. So I find that it's become, especially for me in my practice, but I see with independent audiologists in South Africa, is that we are becoming more proactive about identifying early onset hearing loss so that we can treat, and our outcomes are so much better. And I think it's amazing where you've come. Can you tell me or tell your patients what the benefits really are then for them to come see you in independent private practice?
Firstly, you get an appointment quicker. The other benefit would be, I mean, obviously treatment, type of treatment you get, things like hearing aids. In private, you get to choose based on your hobbies, based on your needs. You get to choose the kind of hearing aid you would like, based on your lifestyle as well. So yeah, those for me would be, I guess, the two most benefits of seeing someone in private.
Keitu, you mentioned that you love to listen to the wisdom and stories that patients come up with as well. And can you maybe tell us, if somebody is watching this at the moment and they want to make an appointment, is it a case, as an independent audiologist, where they come in and maybe they have an evaluation and you just prescribe hearing aids and that's it? Or is there for you a process involved in guiding them through emotionally as well to the impact of hearing loss and treatment that needs to be done?
I love that question. I had a patient recently who I saw, and she had bilateral presbycusis, age-related hearing loss. And I took her through the options that she had. And you could see she was a little bit hesitant to ask if it was okay, if she could go back and discuss it with her family. And I just basically said to her, look, a hearing loss is something that doesn't just affect you, but affects everyone all around you, your communication partners, your colleagues, everyone in your space. And so it's valuable to have those conversations with the people around you. Feel free to bring them in the consult so we can explain the results, explain your options and things like that. So I definitely advocate for the whole person, not just giving them a hearing aid and just letting them go. We do follow-ups as well, where they come after the fittings and we discuss if there are any adjustments that need to be made. So yeah, definitely looking at the whole person, not just prescribing a hearing aid.
It's lovely to see, and hopefully the rest of the population and people that watching this can see that independent audiologists are not only just going to be fitting you with hearing aids, they're going to be looking at a solution. Sometimes the solution includes a hearing aid, sometimes it includes rehabilitation, sometimes it includes counseling and support. But at the end of the day, we're going to look towards giving you a package of care and a treatment solution, which may include a device or two. And so that's really a great message to be passing around. Could you share a special feel-good story about you and a patient that could inspire someone to say, oh, that sounds like me. I think I need to go and see you.
There's too many to share. But my favorite was, I saw an elderly gentleman and he came with a wife, and I saw them, he needed hearing aids as well. And we fitted, and we've just kind of stayed in touch. I have a business WhatsApp number, and the wife loves to send me messages on that number. And then I think a few months down the line, they I would say forced the granddaughter to come and see me and kind of push her into this industry. So I was supposed to let her shadow me for a few patients, kind of see how she needs to get into this industry and basically become an audiologist and become the kind of person that can help other people as well. So I just thought it was special for that to happen, because it made me feel that I had given them a valuable service and something that they felt like they wanted their granddaughter to do as well.
Keitumetse, thank you so much for your time and letting your personality shine through as well. We hope that somebody's watching here and that you'll soon make an appointment with her. We want to thank you that you've given your time here. And you watching at home here, we'd like you to be part of the conversation. So you're going to see in this interview that there's going to be a couple of links where you can reach Independent Audiology South Africa. And we want to ask you to reach out to us, give this video a like, and subscribe to our channel. We'd really appreciate it. And it just helps us so that these videos can be seen by a larger audience. And we want people to be part of this conversation about hearing health. And Keitu mentioned it as well, just preventative audiology. That's really important to us. So thanks for tuning in. Keitu, we want to thank you again. Thanks for making time. It was lovely chatting to you.
Thank you both.